Hello and welcome to AMED Skin Cancer's video series, Skin Cancer Snippets. I am Krista Rubin, a nurse practitioner at Mass General Cancer Center in Boston, and I am the AMED Skin Cancer's Ask a Skin Cancer Nurse. In this video series, we aim to answer commonly asked questions about skin cancer, questions that we see and get asked in our everyday clinic. Our goal is to provide you with clear, concise information that will help you manage and understand skin cancer effectively. Today, we're going to be talking about preparing for the first oncology visit. Now, while it might seem simple, this is actually a question that either family members or patients themselves ask often. What can I expect when I'm going to the oncology office? For many patients, they are transitioning from dermatology, where they've received their care primarily, to oncology for a variety of reasons. It may be that there are multiple skin cancers and the dermatologist has recommended a consultation with oncology, or it may be that the skin cancer is advanced to the point that they want to get a recommendation and possible treatment from a medical oncologist. Okay, so try to think of your appointment in three separate sections, just to make it a little bit easier. The first being, what can you do or what happens before your appointment? Well, generally, if you're going to a new patient consultation, meaning the first time that you've been to this provider, generally records are needed. So that can happen through patients getting the records themselves and having them sent, or the provider that's referring will send the records along. But sometimes you'll get a call from a new patient coordinator or one of the nurses or one of the schedulers asking about records. So you might want to find out if it's your responsibility to get the records and have those sent to the new doctor, or if it's happening behind the scenes or happening electronically is often how it will occur. Logistics. So know where you're going. Things like where to park, how to get there, that's important information. Many centers will send a new patient packet that will include directions, a map, that type of thing. If you are having an appointment in a big city, often the parking garage associated costs can be high. So you might want to find out if they offer discounted patient parking, because certainly that can contribute to the cost of the whole visit. Notebook. I can't emphasize this enough. It's so important to have all of your information in one place. I always recommend that people bring a notebook. Trying to see if I have one around here, which I do. Sorry, but just a simple notebook, something like this that has many pages that you can write down information. Sometimes bringing a folder along with it is great because you can put all your information in one place. A lot of times handouts are given, information on medications, that type of thing. So I say either a 3-ring binder or a spiral notebook or some kind of notebook to write your information down, including questions, phone numbers, all that type of stuff. Really, really important. Medication list. It's very important to bring an updated, accurate medication list with you to your appointment. That includes all of your prescribed medications and then over-the-counter medications, things like aspirin, acetaminophen, ibuprofen. Those are things like Tylenol, Advil, Motrin, those types of things, as well as a list of any vitamins, minerals, herbals, supplements of any kind that you're taking. While not everybody thinks of those as medications, we do include those on a medication list, and that's helpful information in case certain medications will be prescribed in the future, and you need to check interactions to make sure that they're safe to be given together. So it's really important to bring a list of medications with you that's accurate and updated. Medical problems. Always know what your medical problems are. For example, if you were hospitalized when you were a child to have your tonsils removed, for example, you don't need to have that exact date, but you may be asked about prior surgical history, and that means what are the surgeries that you've had in the past. We're generally interested in the more major type surgeries, like did you have a heart attack and required heart surgery, or stents placed, or have you had something removed? And things like, how did you tolerate surgery? How did you tolerate anesthesia may be asked of you. We're trying to get a sense of your overall medical history. Even though you may not think it applies to the visit that you're there for, it does. All right, so moving on to what happens during the appointment. So I have tell about you. And what I mean by that is many patients are embarrassed to tell us that they're hard of hearing or that they don't see as well as they used to. And that's really important for us to know as providers. Just simple things like, could you talk louder during a visit? Or could you turn a brighter light on? It is your appointment. You are entitled to information. If you can't hear or see the information that's being shared, it's really not doing you any favors. So information like that's really important. Speak up or have us speak up if you're not able to hear us as well. Who, what, and treatment. So who and what? Who are you going to be seeing during that visit? That person should introduce themselves to you and their role. For example, hi, I'm Krista Rubin. I'm a nurse practitioner that works with the skin oncology team. I will be blah, blah, blah. You want an introduction. You're entitled to know who you're speaking with. You'll probably be meeting a lot of people during your visits over time, and you want to know who they are. Business cards, if they give you a business card, put it in your notebook that you brought with you. Treatment. If treatment is discussed, if the purpose of the visit is to discuss treatment, it's really important that you understand what has been told to you. Medication names are important, what the schedule is going to be like, what the options are. Have it written down if possible so that you can review it later. Handouts are a great source of information, or have the provider write something down on a piece of paper. Doesn't have to be anything fancy or formal, but just so it can prompt your memory, and put it in your notebook. After, questions always arise after a visit, like, oh, I should have asked this, or what did that person say? I always should have said this at the beginning too, as you're preparing for your visit. I always tell people 2 sets of ears are better than 1. So if it's possible to have a friend or a family member or your spouse or your partner come with you to the appointment, it's always encouraged to have somebody with you, because 2 sets of ears are better than 1. So questions generally come up after. I should have asked this, or why didn't I ask that? Write those down in that notebook, because hopefully you'll have discussed how you can have those questions answered during the visit. Follow-up. What's the plan? Has treatment been recommended? And if so, when, where, what is the definitive plan? Are you walking out of the appointment with a subsequent appointment? Have you been referred to another provider? Are there other tests that need to be done? Try to have all that information concretely written down in your notebook, or you know what the plan is. Because sometimes people or things fall through the cracks, and we want to minimize that happening. And the plan, what is the plan? Is the plan that you're going back to your local provider? For example, if you went into a city or an academic center to get a consultation, and you're following up with a local oncologist or a local dermatologist, your primary dermatologist, whatever, know that that plan has been sorted out and how it's going to be communicated. Generally, the way things work is if one physician refers to a specialty provider, that specialty provider, like the oncologist, will send a note and a letter back to the person that referred, the doctor that referred, and we'll have a summary of what the discussion was. So these are all things that happen relatively intuitively from a provider perspective, but there are so many things that you as a patient can do to advocate for yourself to make it the best possible appointment that it can be. You have every right to understand and hear and see components of your visit, so make sure you advocate for yourself. Nobody is going to advocate for you better. Thank you for tuning in to this episode of Skin Cancer Snippets. If you found this video helpful, please subscribe to our channel for more informative content. And for more detailed information, visit AIM@Skin Cancer. See you next time on the next Skin Cancer Snippets. Bye.